Here we have a first trimester ultrasound demonstrating a intrauterine gestational sac over here. And within the intrauterine gestational sac, we see a yolk sac, and we see the fetal pole along the yolk sac, but we also see this other structure that's got a sort of a hyperechoic rim and is echogenic within, and all of this is contained within the gestational sac. Some measurements are provided. Taking a closer look, we again see that this is separate from the yolk sac. We have the yolk sac here, and we have the fetal pole here, and then we have this other structure that is sort of heterogeneous, echogenic to isoechoic. It appears contiguous with the yolk sac. And we see it again over here. So this is what is known as a chorionic bump or a hematoma. So it's a small bleed in early pregnancy, and it can be a poor indicator for this pregnancy. There is a alternate differential diagnosis of a placental mass, but it's very, very rare. So this is most classic for a chorionic bump or hematoma. So in this case, the patient would just be advised to return for short interval follow-up in about 4 weeks for a follow-up OB ultrasound to reassess the viability of the pregnancy. At this time, when this exam was done, the fetal pole was visualized, and fetal heart tones were seen to measure 126 beats per minute. So this pregnancy at the time was a viable pregnancy, and but the chorionic bump does need to be followed with the short interval follow-up ultrasound.